Equatorial Guinea politician multiple sexual romps with various women go viral on social media. Hundreds of sex tapes involving a high-ranking Equatorial Guinean civil servant with other men's wives have done the rounds on social media, prompting the authorities to attempt to curb their spread. In the videos, the married director of the National Financial Investigation Agency ANIF, Baltasar Ebang Engonga, is seen in flagrante with various partners, including the wives of the prominent officials at his office in the finance ministry. On Monday, the country's Vice President Teodoro Nguema Obiang Mangue announced on X that the government would order the immediate suspension of all civil servants who have had sexual relations in the offices of the ministries, as this constitutes a flagrant violation of the Code of Conduct and the law of public ethics. It is not the first time that sex tapes involving several servants have been leaked on social media, but the affairs have blown up to unprecedented proportions due to the notoriety of the officials involved. Last week, Obiang said that he had given 24 hours notice to Equatorial Guinean telecommunications ministry, regulator and telephone companies to curb the distribution of pornographic videos that are flooding social networks in Equatorial Guinea. As the government, we cannot continue to see families destroyed, said the vice president in charge of defense and security. According to accounts first spread by WhatsApp groups and then posted to Facebook, Instagram, TikTok, and the X, Engonga shot more than 400 pornographic videos in his office. Nicknamed Bello on account of his good looks, Ebang Engonga is a married father and the son of Baltasar Ebang Engonga, the current chairman of the Commission of the Central African Economic and Monetary Community. He is also related to the country's long-serving president. The sex tapes were leaked on social networks at a time when he had been remanded in custody at Malabo's infamous Black Beach prison in a case of embezzlement of public funds, according to state television station TVGE. Equatorial Guinea's chief prosecutor Anatolio Nguema assured TVGE that if medical examination revealed that Ebang Engonga was infected with a sexually transmitted disease, he would be prosecuted for an offense against public health. The flow of internet traffic, and in particular the downloading of images, has been severely disrupted in the country after the authorities took measures to curb the sex tape spread, witnesses told AFP. Social media is awash with speculations that more videos involving other individuals, both men and women, could be released in the next few days. On the other hand, Equatorial Guinea government moves to suspend all officials involved in Baltasar Ebang Engonga's sex scandal. The Equatorial Guinea government says all officials implicated in viral sex video scandal will be suspended. Vice President of the Republic of Equatorial Guinea, Teodoro Obiang Nguema Mangue, said they are going to proceed with the immediate suspension of all officials who have had sexual relations in the offices of their country's ministries. The government will take severe measures against these acts since it constitutes a flagrant violation of the Code of Conduct, Mangue said. His comments come as the country's National Financial Investigation Agency ANIF director, Baltasar Ebang Engonga's more than 400 sex tapes have been leaked on social media. In the videos, the married father of 5 is seen having sex with multiple women, including colleagues' wives, his sister-in-law, and the president's sister, at various places including his own finance office. According to AFP, the government tries to curb the spread of the videos on social media platforms. The videos were shared via WhatsApp groups, Facebook, Instagram, TikTok, and X, formerly Twitter. Equatorial Guinea's chief prosecutor, Anatolian Nguema, said if medical examinations show that Engonga was infected with a sexually transmitted disease, he would then face charges relating to offenses against public health. Engonga is the son of Baltasar Ebang, the current chairman of the Commission of the Central African Economic and Monetary Community. And lastly, AI platform transforms TB detection across nations. Within Africa, accounting for 23% of tuberculosis cases, AI-powered AP control platform has improved the detecting process of more cases globally. The AP control platform was developed by EPCON, which is a healthcare impact organization that specializes in the use of AI to qualify health risks at high spatial resolution. The AP Control platform is providing local teams and healthcare workers with rapid insights into communities that have a high risk of TB transmission. The World Health Organization, WHO, reported the fight against TB is showing slow progress because of limited resources to quicken the detection process. However, the use of AI is showing promise in revolutionizing the TB detection process. The CEO of EPCON, Caroline van Troedeler, pointed out that TB is challenging the detect in low and middle-income countries, LMIC, especially with an overstretched healthcare system. She said AI use has transformed the ability to detect TB in African countries. TB can remain asymptomatic, making its carriers often unaware of their condition. Those with pulmonary TB can infect up to 15 other people through close contact over a year. Without proper treatment, 2/3 of those infected with TB will die. When TB can be quickly and effectively detected, it can be cured. Antibiotics have been available since 1950s, said Van Troedeler. A study published in the Tropical Medicine and Infectious Disease Journal indicated that the AI capabilities of the EpiControl platform's hotspots mapping model were determined to be 75% more accurate in predicting TB hotspots in Nigeria than traditional approaches. The EpiControl platform is used to facilitate data visualization, real-time monitoring, and predicting. Using Bayesian machine learning, the AP Control platform uses the hybrid generic algorithm to process large-scale epidemiological and clinical data to predict disease spread and impact. The AI model has supported projects across Pakistan, Nigeria, and the Philippines, South Africa, the DRC, and Guinea, which benefited more than 2 billion people. Using our AP Control platform, which integrates routine programs data with local socio-demographic and contextual information, we identified TB hotspots for targeted active cases, finding with impressive results. The TB positivity yields at these models predicted hotspots were significantly higher than those at conventionally selected sites, 73% higher in Lagos, 95% in Ogu, 103% in Osun, and 75% in Oyo, said Van Troedeler. EPCON partnered with Equity Innovations to develop a TB risk predictive model for the Nelson Mandela Bay Area, which increased detection rates from 0.2% in random screening to 0.9% using the model-based approach. Equity is a public health organization that leverages evidence-based interventions to support the South African government's effort to develop cost-effective strategies aligned with the global TB goal aimed at eliminating TB by 2035. Director of Health Programs at Equity, Dr. Sipho Nyati, said, "With the AP Control platform, we can now quantify the TB burden at the community level, allowing us to focus our efforts more precisely and ensure interventions are both targeted and cost-effective, which is critical in environments where resources are increasingly constrained. Van Scherverlet said, as an organization, EPCOM is committed to strengthening health systems and supporting government and NGOs. This requires a holistic and integrated approach involving all stakeholders, including healthcare providers, patients, and public health officials. We are committed to expanding our AI's capabilities to model a broader spectrum of diseases, including non-communicable conditions such as diabetes and cardiovascular diseases, said Van Scherlerlet. The EpiControl platform in the country drastically reduces the cost of finding and diagnose TB cases from $1,748 to $437 compared to conventional approaches. And that's it from Egypt, Africa. Stay tuned to USA political updates.